Okay, so to start this off, I would look at the mental status. So I look to make sure he's alert and oriented. I would look at his affect and his behavior. I would also look at his height and build, how he's dressed, how he's acting, and I would keep reassessing this throughout. I would also look at his hygiene, and then I could also see how he interacts with his family members, if there's anyone with, and his dress. And then I'm going to move to the cranial nerves. So I would have you for number 1, olfactory. I would have him close his eyes, occlude one side of his nose, have him smell a scent that's familiar. I would do that bilaterally. And then I would do optic. So I'm going to do test his peripheral vision. So I'm going to have you look right at my nose. And don't move your eyes. Tell me when you see my fingers.
No. Now. 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 Now.
Good. And then I would also do for visual acuity, I would use the Snellen chart, the Jagger chart, and I would look for, I'd have the color discrimination card. Number 3 is ocular motor. Number 4 is trochlear. And number 6 is abducens. So for this, we're going to do the 6 cardinal signs of gaze. So just don't move your head, but follow my finger. Follow my finger. And then I would also do Perla. So I would have you look right at my nose, and I would have you, good, I'm looking for direct and consensual reflection or restriction of his pupils, which they do. And then I would also test for convergence. So I'm going to have you stare at this and just concentrate on this, that you're going to feel like your eyes are getting crossed. Good, which he has good convergence. And then we're going to do the cover test. So I'm going to have you stare at the wall behind me, and then I'm going to have you keep staring at it once I take my hand away, and I should see your pupil change. Good. His pupils actually dilated down. And then I would do, what's that? 5 is trigeminal. So I would have you close your eyes and tell me which part of your face I'm touching.
Forehead, cheek, chin.
Good. And then I would have you flex your jaw. Good. And then open it and go side to side. Good. Okay. That all's good. No popping or cracking. And then I would do facial. So I would test the anterior 2/3 of his tongue for sweet, salty, bitter, and sour. And then I would have him test his facial muscles. So I would close your eyes tight, open them, eyebrows up, smile, frown, show your teeth, puff out your cheeks. Good. Whistle. Good. Okay. And then 8 is vestibular cochlear. So I have 3 hearing tests I'm going to do. I'd first do the whisper test. So tell me which word you hear. Apple.
Apple.
Orange.
Orange.
Good. And then I would do the RIN test. So I'm looking for air conduction versus bone conduction. So I would strike it, stick it right on his mastoid, have him tell me when he can't hear it anymore while I'm timing it, and then move it to air right by his ear to test air conduction. It should be a 2-to-1. And then I'm also going to test for lateralization. So I would strike it, put it right on the top of his head, and have him tell me which ear he hears it out of, and hopefully it's both. Number 9 is glossopharyngeal, so I'd have you say ah. Good. I'd look to make sure the uvula is midline, which it is, and there it raises. And then 10 is vagus. I would do the gag reflex on him. Number 11 is spinal accessory, so I'd have you shrug your shoulders against resistance. Good. Turn your head against my hand. Good. Good. Those are all intact. And then number 12 is hypoglossal, so if you stick your tongue out at me. Good. It's midline. Put your tongue away. Push it against your cheek. Push it against your cheek. Good. Okay. All cranial nerves are intact. And then I'm going to go back to integumentary. So I would assess the skin. It is appropriate for his race. I don't see any open lesions, any rashes, or any sort of discoloration. I would palpate his skin. I would look for temperature, warmth, moisture, and then I would test the turgor, which is good. There's no tenting. And then I would look at hair distribution across the body to make sure it's all equal, which it is. And then I would assess his hands. and his fingers. Make sure there's no clubbing or any deformities on his nails, which there's not. His cap refill is less than 3. And he has appropriate hygiene for those too. Okay, then I'm going to come back to the head. So I would look for symmetry of the eyes and the ears, which there is. I would look for any lesions, any open areas, any masses that I could visibly see, which I don't see. I would palpate through the scalp, notice any tenderness or any masses or bulges or any lesions, which I do not see. I would also palpate the facial bones, make sure those are all intact. I would do the frontal and maxillary sinuses. And then I would move to the eyes. So I would first inspect. I would look at the eyelashes and the eyebrows. There's no buildup or any sort of drainage. I would look at his irises, which they are equal and round. I would look at the sclera, which is nice and white. I would pull down and look at his conjunctiva, which is nice and pink. And then I would do my eye test. So I'd have my ophthalmoscope and I would go eye to eye, coming right up to his nose, following the red reflex in. I would look for the red reflex. I would look for the macula, and then I would look for the blood vessels and the retinal background. And then I already did my perla with my other thing, so that should be good. And then I would move to the nose, so I'd look for symmetry. I'd look for any drainage that I could see or any redness, which I don't see. I would palpate the nose. And then I would use my otoscope and I would look up the nose. I'd look for any polyps, edema, drainage, what color it is, or if there's any foreign objects. I would look at the turbinates and I would look at the septum to make sure it is midline. And then I would move to the ears. I would look at from the outside. I'd look to see if there's any drainage, any lesions. Since he wears glasses normally, I would look behind his ears. And then I would palpate the auricle, the helix, the tragus, and the mastoid. And then I would take my otoscope, I'd pull the pinna up and back. I would go in, I would look at the tympanic membrane, make sure it's pearly gray. I would make sure there's no foreign objects. I would also make sure that there's no perforation. I would also look to see if there's cerumen. And then I would look for the cone of light, which would be 5 o'clock on the right, 7 o'clock on the left. I would look for the umbo, the cone of light, the annulus, the malleus, and the long handle. And then after that, I would move to your mouth. So I would look at your lips, look to make sure they're not dry or cracked, that there's no lesions, that they're symmetrical, which they are. I'd have you open your mouth. I would look at your dentation. I would look for any caries. I would have you lift up your tongue. I would look at Wharton's ducts, which they look good. I don't see any lesions underneath. I would look for Stenson ducts on the side, which those look good. I would look at his hard and soft palate, and I would look at his uvula. I would have him stick out his tongue, and I would look at his tonsils. They're a grade 1. And then I would palpate, and I would also note the odor of his breath. I would also palpate. I'd have gloves on. I could do my bimanual palpation through his cheeks and underneath his jaw, and then I could palpate his tongue and his hard palate. Then I would move to his neck. So I would look to make sure the trachea is midline, which it is. I would look for any masses, and then I would look for any discoloration, which I do not see. And then I would palpate his neck. I'd again make sure the trachea is midline. I would look at his thyroid, which I could do behind him or in front of him. And then I would have him swallow. Good. I would notice if there's any tenderness, any swelling, any nodules, a goiter. I would make sure it was smooth, and I would check the size to make sure it's appropriate. I would then look at my lymph nodes. So I have preauricular, postauricular, occipital, submandibular, submental, or these can be tonsillar, submental, anterior cervical, posterior cervical, supraclavicular, infraclavicular, and none of those are palpable, so that is good. And then I would check for JVD, so I'm going to have you go that way. I don't see any. While I'm here, if he was laying down, I could do this probably better, but I would test for his jugular venous pressure. So where I see it pulsating, I'd put this out at a 45-degree angle, and I would measure, and it should be less than 3 centimeters, which it is. I would also palpate his carotid, so I would do those one at a time, and those are 2+. Good. And I think that's it for your neck. Next, I'm going to move to the lungs and thorax. So I would first assess. I would look at any bony prominences, any trauma, any pulsations or heaves that I notice. I'd look at his work of breathing, make sure he's not using any accessory muscles. It looks like a normal rhythm, and he doesn't look like he is struggling to breathe. I would point out my landmarks. So I have the clavicles, I have the suprasternal notch, the manubrium, the angle oblique, the sternum, the xiphoid process, costovertebral angle and margin. And then you have the mid-sternal line, then you have the mid-clavicular on both sides. And then I would auscultate. So right second intercostal is aortic, left second intercostal is pulmonic, left sternal border at the 3-4-5 is tricuspid, and the mitral is mid-clavicular on the left at the 5th intercostal. So I'm going to first listen to all his lungs. I would have him take a deep breath every time using the ladder pattern. Good. Then I would listen to his heart sounds while I'm here. I would do this with the diaphragm and the bell. And then while I have my stethoscope out, I would also listen to his carotids for any bruits, which I do not hear. For lung sounds, there was no adventitious sounds, no wheezing, rhonchi, stridor. For heart sounds, it was a S1, S2. There was no gallops, murmurs, or rubs. And then I would percuss, and I would look for resonance over the lung fields, and then we'd probably have cardiac dullness. And then I'm going to have you stand, and we'll do the back. So I would also auscultate the back, and I'll show you my landmarks when we do this specialized test. But landmarks-wise, we're going to have the 12th rib, the 7th rib, which is underneath the scapula. We're going to have interscapular between infrascapular below. And then we would have the vertebral line. We would have the the scapular lines. And then we'd have the C7 through T1. And then I'm going to test for thoracic expansion. So right at the 10th rib, I'm going to have you take a nice deep breath. My thumb should go out and come back in. That should be adequate. And then we are going to do, I'm going to test for a diaphragmatic excursion too. I would percuss throughout the whole lung field. But since we did that anteriorly, I'm not going to do that. So for diaphragmatic excursion, I'm going to have you take a nice deep breath in and hold it, Alex. And I'm going to percuss up until I feel dullness. Good. I would mark that. You can breathe. I'm going to have you take a nice deep breath in and then blow it all out. I'm going to do the same thing, percuss up till I feel it. Feel that dullness. I would mark that. You can breathe. And then that should be 3 to 5 centimeters. Then we're going to do the specialized tests. So we are going to do whispered pectoraliloquy. So Alex, I'm going to have you whisper 1, 2, 3. And it should be almost indistinct.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. That was good. We're testing for consolidation, which that was indistinct. Next, we're going to do bronchophony with 99s, and that should be faint and distant.
99, 99, 99, 99, 99, 99, 99, 99.
Good. Next, we're going to do egophony, so you're going to say E, and if it sounds like an A, that means there's consolidation.
E, 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 E.
Good. And that was perfectly fine. Okay. I believe I'm done with the lungs. You can go ahead and sit down. I've already auscultated the heart sounds, but now I would look for any pulsations or heaves within the cardiac realm. I would also palpate along here. I would look for the point of maximal impulse. If I couldn't get it sitting up, I could always have him lay down or turn on his left side. I could also have him lean forward. That would bring it closer to the heart wall. I would percuss to make sure to look at the cardiac size and to make sure that point of maximal impulse is not displaced, which it is not. I already listened to the carotids. I listened to all of that. Okay, I'm going to move on to the abdomen so you can lay down. I am going to first inspect the abdomen. So I would look for peristalsis, I would look for any pulsations, I would look for any masses or hernias that I could see, which I do not see any. Then I would auscultate. I'm going to auscultate in all 4 quadrants using my diaphragm. And then I'm also, while I'm here, I'm going to auscultate the aortic, the renal, the iliac, and the femoral. Good. Those are all good. No bruits were heard throughout. And then I would move to percussion. So I would look for tympany throughout the abdomen. And then I am going to measure the size of the liver through percussion. So I start about the umbilicus and I would go up till I hear dullness right about there. And then I would come down through the intercostal spaces until I hear dullness again, and you want that to be 4 to 7. For the spleen, it's the 10th mid-axillary on the left. So I would go in there, I'd have him take a nice deep breath and hold it. Good, you can breathe. And if it was enlarged, it would be dull when he's taking a nice deep breath in. I could also do the gastric bubble, which is right on the left, right below the ribs, and check that. And that is good. Okay, now I'm going to palpate, so I'm going to lightly palpate first. About 1 centimeter. Good, I would notice any muscles or I would palpate for the muscles, any masses or hernias that I could feel. I could also have him I would have him lift his head up and I could see if there's any muscle problems with splitting or anything. Okay, you can relax. And then I would deeply palpate, about 3 to 5. Good. Don't feel anything. I would be looking for masses or any sort of abnormalities that I could feel. Next, I'm going to palpate the liver, so I could do a hooking method right under his ribs. Sorry. And then I'd have you take a nice deep breath, and you should be able to feel that. The spleen, I can come in and do it by manual. Take a nice deep breath. Good, I don't feel anything, which is normal. I could do the kidneys, I would do bilaterally. So I would do, just kind of palpate in bimanually, see if I can feel them, which I can't. But if I could, I would be able to feel the right over the left. And then I would check for the aortic pulsation, if I could feel it. And then I could also check the femoral arteries. And then I would do my testing. So my Murphy sign, checking for cholecystitis. I'd have you take a nice deep breath, and I'm going to push in. And if he stopped and you can let it go. Just take a nice deep breath. And if he stopped his inspiration, that could be indicative of cholecystitis. And then we can check for rebound tenderness. So if it hurt more when I let go, that would be rebound tenderness. The iliopsoas sign. So I'm going to have you lift your leg up. And if that caused any pain, I'm going to have you bend your leg, push against my hand with your femur here. Good. And if that caused any pain, that would be positive. And then we can do the obturator, which go in and out. And if that causes any pain, that would be positive peritonitis. You could do McBurney. So between the umbilicus and the iliac crest, you're just going to push down. And if that causes any pain, that could be indicative of appendicitis. And then you could do the Rosvig test where you're on the opposite side, you're on the left, you're doing the same thing. If that caused pain on the right, that could be indicative. You could also do the heel jar test where you have your patient go up on their the tip of their toes and kind of drop down on their heels. And if that causes any pain, that could be indicative of peritonitis also. Okay, abdomen is done. Next, we are going to move on to sensory. So you can sit up again, Alex. So I would start this off with vibratory. So I'd have a tuning fork. I would go distal to proximal. So I'd start on his toe, go to his ankle, his knee, any bony prominences. I could do fingers, I could do wrist, elbow, shoulder, and see where he could feel that. I could do the monofilament testing. So I would grab his leg. I would have 10 points on here that I would poke, and then I would have him tell me if he could feel them, and that is indicative of peripheral neuropathy. And then I would do my stereogenesis. So close your eyes, put out your hand, and tell me what you have in your hand.
Quarter.
Good. And then we're going to do graphesthesia. So put out your hand again. Tell me what I'm drawing.
An L.
Yep, good. And then I could do 2-point discrimination. So I'm going to have you tell me if I'm, close your eyes, if you have 1 or 2 on you.
2.
Good.
1.
Good. And I would do that bilaterally, all the extremities. And then I would do position sense. So I'm going to have you close your eyes, and I want you to tell me if I'm lifting your finger up or down.
Up.
Good. And then I would also do that on his big toe. Keep your eyes closed, up or down.
Down.
Good. Okay. And then I would also check just his sensory in general. So I could do, close your eyes. Tell me where I'm touching you.
Arm.
Which one?
Left arm. Right leg.
Good. And if you couldn't feel that, I could do temperature. So I could do hot and cold. Or I could do sharp versus dull. So close your eyes. Tell me if this is dull or sharp.
Dull. Sharp.
Good. And I would do that on all the extremities if I needed to. And then I would do reflexes. So I would do your superficial reflexes. So I start with the abdominal. I'd go from the umbilicus out in each quadrant. And you should see the umbilicus kind of twitch that way. You could do the ceramic. I can't remember how to say it. Sorry. You stroke the inner thigh. And you should see the testicles and the scrotum reflex that way. And then you could do the plantar. So you're going to kind of scrape along the whole bottom of the foot and watch for the toes to flex, which is normal. And then we would do your deep tendon reflexes. So I would do your brachioradial. I would do your bicep, your tricep, and then I would do patellar. And then I would do Achilles. And then I could also test for ankylosing by flexing that foot up fast and hard. And then watching for a repetitive jerking movement. And then, okay, I think that's it for that. I'm going to have you stand up. And we are going to have you do deep knee bends. See how far deep you can go. Good. Okay. And then I'm going to have you walk towards me heel to toe. Good. Then I'll have you turn around, walk back on your toes. And then walk back to me on your heels. Good. Okay, and you can walk normally back. I would look at his gait. And then you can do ankle to shin. Just go all the way down the front. Just down the front. Good. Other side. Good. Okay, those are good. And then I would test for pronator drift. So I'm going to have you close your eyes. And okay, watch me first. Sorry. Close your eyes and go out like this with both arms. And close your eyes. And I would look for pronator drift. To use pronator drifting, he would just kind of come down. And then I'm going to do the Romberg test. So I would just have you close your eyes and stand there. And then I'd look for any swaying. I would obviously be closer to him and look to see if that is causing anything. Okay, you can open your eyes. And then let's do, I'm going to do nuchal rigidity. So I'll have you lay down. And I'm going to test for nuchal rigidity. So I would just have you lift your neck up if that caused any pain or discomfort. Brudinsky sign is if I did that, his knees and his hips would just automatically flex up. That would be a positive sign. And then Kruvig sign is if I flexed your knee and then went to straighten it out and that caused pain. Okay, perfect. And now I'm going to move to musculoskeletal. So since you're laying down, I'll just start right here. We'll start with the hip. So we're going to flex. So go up. Good. And then I would have you do it against resistance. And then I would also have him extend. So I would have him go backwards, or I could have him prone and do it. And then I'm going to have you abduct. So I'm going to have you push your leg out towards me against resistance. Good. And then come in across your body for adduction. Good. Against resistance. Good. Those are good. And then I would also be checking femoral, and I could check the inguinal too. How I would do that is I'd have to go down deep into the groin. And then I would have inspected the hip first too. Sorry, I would look for any crepitus or any open areas. And I would have palpated it too. Next, I'm going to inspect the knee. I would look for any sort of effusions or anything that I could see. And then I would palpate around the knee. I'd palpate the popliteal space. I would check the popliteal pulse. And then I would do my knee test. So I would do the test for ballottement. So I would push down on the femur a little bit. And I'd push down around the patella and feel for any crackling or popping sound, which there is none. And then I could test for lateral or medial meniscus using the valgus and vargus moves. So I'm going to hold, sorry, you guys probably can't see this. Hold your knee and your ankle, and I'm going to pull both out. And then I would try to straighten and see if that causes any pain. And then I would go in and test the lateral or medial, test the medial and see if that caused any pain, which it doesn't. And then I would do, okay, I can't remember the name for this test, but I would stroke the lateral side of the knee to see if there's any fluid, and then I'd push against the medial side to see if that fluid came back laterally. And then I could do the I'm going to have you flex your knee. I would have the posterior and anterior drawer test, so I would test the anterior, the ACL and the PCL. So I would pull out, I'd be testing the ACL, back, I would be testing the PCL. Okay, next I'm going to do the feet. So I would first inspect the ankles, and then I would palpate them. I would palpate the lateral and medial malleus, and then I could do the dorsalis and the posterior tibial pulse. And then I would have you, I forgot to do the knee. So I would have him, I don't know if I did this, flex and extend the knee. I could also have him sitting up and have him do it against resistance too. Okay, now I'm going to have you push against me. Good. Pull up towards your nose. Good. Those are dorsi and plantar. And then I'm going to have you do inversion and eversion. So can you kind of twist your ankle in and out? Good. Okay. And then I would have you rotate. Rotate. Good. Okay. That's good. And then I'm going to have you sit up. And I'm going to have you, we will do your shoulder next. So I'm going to have you abduct out. Actually, maybe stand up. It may be easier. Abduct out. And then we're going to adduct across your body. Good. And I'm going to have you do that against resistance. So good. And then I'm going to have you flex your shoulder. Flex. And then extend behind as far as you can. Good. And then I'm going to have you do internal rotation and external rotation. So external rotation to kind of itch your neck. Internal rotation, I'm going to have you like scratch your back. Good. Okay. Good. Okay. Shoulders done. Elbow. I would have inspected and palpated his shoulders first. I'm really terrible about this time. Okay, then I'm going to look at the elbow. I would look first, inspect, and then I would palpate. So I would palpate the olecranon, and then I would palpate the medial and lateral epicondyles. And then I would have you flex, so go like this, up, good, against resistance, and then push down against me, good. Good, flex and extend. And then I'm going to look at your wrists. So I would inspect them, I would palpate them, I would palpate into the MCP. I would have also done this on the toes, just so you know. And I will have you flex your wrist, good, extend your wrist, good. And then I'm going to have you go radial and ulnar deviation, good. I'm going to have you open your fingers, which is abduction. I'm going to have you adduct your fingers back, good. And then I'm going to test your thumb flexion. So I'm going to have you go like that. Go down against my finger. Good. Okay. And then I'm going to have you hand grasp me. Grasp both equally tight. Good. Good. And then I'm going to do your cervical, which I kind of already did with my other test. But I would inspect, look at the C7-T1 specifically. And then I would palpate, which I already did, and then I would test the head movements, which I already did. And then I would look at the spine. I would look for any sort of misshapen spine. I could have him flex over, so bend over, and I could test for any sort of scoliosis, which I do not see any humps. You can stand back up there. And then I'm going to palpate down the vertebrae. And then I would palpate down the paravertebral muscles. Good. So I already had him flex. I'm going to have you extend back as far as you can. Good. And then I'm going to have you go side to side. Good. And then I'm going to have you like rotate. Good. Good. Okay. Perfect. Okay. I think that's it.